Today is September the 21st, year 2001. I'm here with Frank Fabiano, and this is a follow-up visit, one of many follow-up visits, correct?
Right.
When did you start coming to the clinic?
4 years ago.
4 years ago? Okay. And where were you when you first started coming to the clinic, Mr. Fabiano? How were you physically and mentally when you first came?
Mentally I was okay. I used to wear a brace on my leg, and I was in a wheelchair probably about 70% of the time to get around.
Okay.
But after coming, let's see, the first time I came was in, remember what month it was?
I don't remember.
It was in February, I think. And the first week I was here, I was able to start moving my arm and moving my foot, which I couldn't do before.
Wow.
And then when I went back to St. Louis, Dr. Hammesfahr had me take magnesium intravenous. I went twice a week for 8 weeks, and about the 4th or 5th week, I got rid of the brace on my leg. I didn't need the brace no more.
Fantastic.
And I started driving. I mean, well, I was driving before that, but not as much. But I drive myself around now.
That's fabulous. That's great.
And I can use my hand, which I couldn't do.
How was your hand before?
My hand was like this.
Just stuck together?
It wasn't stuck together, but, you know, it was just, I couldn't do nothing with it.
Okay.
When I started eating, I can eat a little bit with it. Naturally, gets tired.
Okay, good. That's wonderful. So now
And
it's
I cut my own fingernails now,
good.
which she used to have to do all the time before. But I did that right after when I started getting the magnesium treatments.
Good. So you started getting results right away then?
Oh yeah.
Great, wonderful. Well, what are some of the newest things you have seen lately?
Well, it's hard for me to say. It's just little things, you know, that I notice. Like I said, doing my fingernail, which you know somebody else don't mean nothing. I can pick things up with my right hand now, which I couldn't do before. If I can reach it, you know, stuff like that.
Okay, great.
I don't know.
You can wave goodbye.
Oh, I can wait. Yeah, I shake hands now.
Okay. Are you able to do the thing, touch all your fingers?
My fingers,
Wonderful.
they get tight. They go, you know, if I get nervous, they get tight.
Okay.
But
Fabulous. That's wonderful. Well, if you were to talk to another stroke patient and tell them about what's been happening with you here, what would you tell them about the clinic?
oh, I would tell them, you know, that I've seen some people here that they didn't progress as fast as I did. But then they hit plateaus on the way. You just can't give up. You have to. That's why I call the doctor up and come down here, because I get to a point where I don't see any improvement, or I seem to be backing up. I'm not, you know, seem to be going backwards. But to me, I'd be going backwards to somebody else that hasn't seen me in a couple